You considered causes of reading difficulties in students when you responded to the introductory discussion board. I'm sure you came up with some good ideas based on your experiences with your students. This is actually the topic of this week's reading that you will do in the book. We'll talk about that a little bit further. In that reading, I think you might find a few surprises. But in our discussion of reading interventions, it's first important to understand some of the underlying causes of what happens to students that they experience reading difficulties. The most successful reading intervention programs will take into consideration why the reading problems exist in the first place, and then attempt to match strategies to the learner. But regardless of the cause, we have to refer to these students as something. So let's consider some labels that we have heard for these students in the past. Reading educators often refer to these students as disabled readers. A disabled reader is generally a child who has difficulty with reading despite adequate intelligence and also quality classroom instruction. For some reason, they're still experiencing difficulty. The term delayed reader pretty much means the same thing. However, it's a little bit of a kinder, gentler term for students, so you often hear a delayed reader instead of a disabled reader, but they mean the same thing. More recently, terms like struggling reader, striving reader, high needs reader, at-risk reader have come into vogue. They all also pretty much mean the same thing. They're students who are experiencing difficulties with reading and aren't progressing the way that their peers are, despite the fact that they have an average intelligence quotient and also they've had adequate instruction. But for some reason, something is blocking the reading from progressing. I personally usually default to struggling reader. I don't know why. That just is usually the term that comes out of my mouth. But that's what I generally say. So, whatever term that you use, we're all talking about the same children. Now, there's another term that has come into vogue lately that you will encounter in the text when you read it, and actually I like this term. The term garden variety poor readers is heard sometimes. This is a special category of students who have reading difficulties because these are students who have reading difficulties that stem from environmental factors and the life experiences that they've had. So these are the students who have adequate intelligence, and there's no biological reason why they would have difficulty reading, but their upcoming has maybe had limited vocabulary development, limited life experiences, limited exposure to text and to language, so that they lag behind their peers in their reading development. These children usually respond pretty quickly to adequate reading intervention programs because there's really no reason other than those environmental factors for why they are struggling. So garden variety poor readers, I really do like that term. Now the term learning disabled, it has come into play recently that learning disabilities and reading disabilities are now kind of considered to be one and the same thing. Because if you think about it, a child who has a learning disability, it's most likely going to present itself as difficulties with reading. There's going to be some sort of language barrier that is causing the child to have difficulty, and that is generally going to show up as a reading difficulty. Now, not to say that there aren't some students who their struggles are mostly with numbers. However, those students are very, very few and far between. The wide variety of students who are learning disabled generally are going to have reading trouble. So again, it's pretty much considered that a learning disabled reader and just a disabled reader are the same child having the same difficulties. So now that brings us to the term dyslexic. Dyslexia and labeling a student as dyslexic is a very, very tricky practice, and it's one that educators are now trying to avoid. And the reason is because it's very, very difficult to come up with a true medical diagnosis for a dyslexic child. Not to say that there aren't some students, because there certainly are, but to readily label just any child as dyslexic is very problematic. So I want you to watch this little video that I found that does a much better job of explaining why we want to try to avoid labeling students as dyslexia. So I'm going to let you watch this and enjoy it. Actually enjoy their accents because they're kind of fun to listen to.
One of the things that happen quite often when a youngster is struggling with their reading is that some well-meaning soul will come along and say, have you ever thought that perhaps little Jimmy might be dyslexic? Perhaps you should go, send him off for a dyslexia assessment and see whether he is, and if he is, well, great. Now, there's all sorts of problems with that. The first problem is that actually making a diagnosis of dyslexia is not scientific, because the criteria that people use vary greatly from one person to another. In other words, what one person thinks is dyslexia, another person doesn't. So firstly, you can't make a decision in a clear, consistent way about whether a child is dyslexic or not. Secondly, even if you do decide or determine that the child is dyslexic, having done that, there is no intervention, there is no educational treatment which you would do differently for that child than you would do for any other child who's struggling to learn to read. There are some weird and wacky interventions and treatments, but none of those have the support of academic scientific research.
I don't agree with labelling children. It's not a helpful term. It's not helpful to label children with dyslexia, because if a child was diagnosed with dyslexia, or a child wasn't attaining the expected levels, we would treat the child exactly the same in terms of intervening or teaching their next steps. It would be exactly the same. Of course, there are children with more difficulties than others, and what we do for those children, if they aren't accessing the curriculum or reading and writing within the classroom, they will get extra support in class, they'll get extra support out of class. We'll do one-to-one interventions, we'll do very small group works where their teacher is focused solely on their next steps of learning to ensure that they can progress and they can achieve.
Our instinct when our children are struggling, our instinct is to find some kind of cause, some kind of label that explains it. And so there's a strong desire on the part of parents to find some kind of term, such as dyslexia, which might explain it. It's quite clear that for a significant proportion of children, there are very real difficulties in learning how to read, how to decode text. And that absolutely exists. What I think is problematic is the notion that for a smaller group of those children, there is a condition called dyslexia which can be identified clearly and consistently. And that's the problem. People get confused because when they hear things like dyslexia doesn't exist, it seems to be saying that actually the problems their children have in learning to read are somehow not valid, not real. And that of course, is wrong. But I think we have to realize that the term dyslexia is increasingly understood as problematic, and really we would be much better off not to use it any longer.
Okay, so as you can see, the claim is that using the term dyslexia can be problematic, and really for us as educators, what matters is what we do to help these students and not necessarily the label that we put on them. However, as we said, or as the video said rather, there are truly students who have a condition that would be considered dyslexia. So recently, some educators, medical personnel, and psychologists have agreed on a categorical model as a definition, and I do want you to note that this is due to some brain scanning imagery. Because we now have the ability to scan students' brains while they're reading, we have learned so very, very much about how reading develops in students. So that's just a cool thing to be aware of, that how the brain functions is a very, very large area of study in reading development. But anyway, if we had to use the term dyslexia, we're going to look at students who have a serious delay in acquiring reading skill despite the adequate intelligence, hearing, vision, and oral language, a congenital neurological cause that is not environmental in nature, sometimes a hereditary factor, but sometimes not, difficulty mastering other written language skills, problems with phonological processing, and treatment resistance. So now if you consider this list, there's really only one factor on here that's going to separate these students from our garden variety poor readers that we discussed earlier. Do you see which one it is? Hopefully you notice that it's this one, a congenital neurological cause, not environmental, because as we said, our garden variety poor readers, their reading difficulties are environmental in nature. However, the other factors can be exactly the same. And as the video claimed, we are going to work with these students pretty much the same no matter what we decide to call them. Okay, so regardless of what we call them, we know that we want to help them. So how do we identify whether these students are going to qualify for reading intervention? So there are two general models that are usually used for identifying students, the first one being the discrepancy model. And with the discrepancy model, there's a comparison made between the student's present reading ability and his or her reading potential, or where that child should be reading. The problem with the discrepancy model, or what makes the discrepancy model difficult, is that in order for that to work, you need to know what the child's reading potential is. So you need to know things like the child's chronological age, the child's intelligence quotient, the environment in which the child has been working, all sorts of things will play into what that child's reading potential is. So it's kind of difficult to make that determination. Then there's the treatment resistance model. This one is a little bit more widely used now, and this is determinations are made about whether a child is resistant to high quality instruction that is working for many other students, and that's the key part. The instruction is working for the other students that are on that child's age range within that child's class. So the instruction is fine for them, but for some reason for this child, the child is not responding and is not progressing. So that would be a child that might be considered for reading intervention. However, you can see that these two models, if we stick with just these, we're going to identify a whole bunch of kids as needing quality intervention. So what was happening was that a whole bunch of students were being over-identified for special education classes who really did not have true special education needs. So several years ago, the response to intervention plan came into play. You may have heard of this as the RTI, or the tiered model, or the models of RTI, or the models of reading intervention. Or rather the tiers of reading intervention. But in case you haven't, just a quick little review of this. RTI is a three-tier way of thinking about reading intervention. Tier 1 being the least restrictive, up to Tier 3 being the most intensive and the most restrictive. So taking a look at these individually, if we're thinking about a Tier 1 program, we're thinking about the general developmental reading program that every child is in, pretty much. So if you think in an elementary classroom, you think of the reading block. This would be the instruction that's happening in there. And just FYI, a quality developmental reading program is going to have these components. It's going to have phonemic awareness, phonics development, fluency, vocabulary, and comprehension. So assuming all that is happening in a classroom, there's a child that needs a little bit of additional support. So within that classroom, that child's going to get some sort of corrective assistance. And it might be that the teacher would pull that child for a little targeted small group instruction, or they might give some additional scaffolding to that child. But the child remains in the classroom with all of his peers, but just gets a little bit of extra support. That's a Tier 1 of RTI. Okay. Now a Tier 2 becomes a little bit more intensive, and this is where a child receives a remedial reading program. Generally, they're administered through either a push-in or a pull-out program, more likely a pull-out, where the child will be removed from other instruction for a time during the day or a couple times a week or whatever, and they'll receive a program, an intervention program that's delivered to them through a specially trained teacher, a highly qualified specially trained teacher. A component of these programs is that there is frequent ongoing assessment that happens through the program, so we can determine what are the child's specific problems and specific needs, and what then are the interventions that we're going to do for that child to move them forward and to fill in their holes, if you will, to help them develop those reading skills that have not developed. This should be very fluid, meaning that a child who succeeds in a Tier 2 reading intervention through this ongoing assessment, it's determined that they're doing much better. The child should be able then to just move back into Tier 1. It shouldn't be, like a year-long sentence if they've been moved into Tier 2. It should be something that's fluid, and a child should be able to move out of it if they progress. Now, Tier 3 gets us much more intensive, and these are the students who generally are going to be in a special education self-contained setting outside of general education setting where they have a qualified teacher who is going to deliver an intensive program with them, generally in a very, very small group or ideally on a one-on-one situation. The assessment is going to be much more extensive. Generally, there's an awful lot of paperwork that goes with it, a case study. And that remediation is very intense and very individualized. And if you remember, that was the smallest part of the pyramid because this should be the fewest number of students who will get this very, very intensive support. For our class that we're going to be participating in for the next couple weeks, we're going to be focusing on those Tier 2 and those Tier 3 interventions and taking a look at what happens during those programs. So there's a little reflection following this video that I would just like you to fill out. Just my way of knowing that you hung in there with me and you watched this video and learned this information. So be on the lookout for that within the module and make sure you post your little response because remember you do get participation points. And then your reading for this week, you're going to read Chapter 2 in the instruction students who have literacy problems, but just these pages, 33 to 53. On these pages, you're going to read about some of the factors of reading problems like we've been talking about. But as I said, I think you might find some information surprising when you're doing that reading. Just think about what you said in the beginning of this module were some of the causes and kind of compare that to the information that you're reading. There will be a discussion board posted to reflect on that reading. And remember, that's a discussion board where you're going to post your response by Thursday and then respond to 2 classmates by Sunday. And just a quick little reminder that you're going to need to investigate some reading intervention programs that are used in your school and try to have some access to them so that you could use that for follow-up number 2. Okay, thanks for hanging in there with me, and I will talk to you guys soon.